Let's discuss the AIIMS November 2018 Physiology questions. Question number 1. The answer of this question is C, 14. Now, let's discuss the question in detail. Suppose this is the Bowman capsule. And this is the glomerular capillary from which the filtration has to occur. This is the glomerular capillaries. So there are 4 forces for the filtration. The force from the glomerular capillary to the Bowman capsule, which is helping in the promoting the filtration, is known as hydrostatic pressure in the glomerular capillary. The hydrostatic pressure in the Bowman capsule is opposing the filtration. This is known as PBC. Now another 2 forces are oncotic pressure in glomerular capillary and the Bowman capsule. The glomerular capillaries, the force, the oncotic pressure is pi GC, which is opposing the filtration, and in the Bowman capsule the hydrostatic pressure is pi BC, which is helping in the filtration. But here, because the pi BC is equals to 0, because in the question it is given that assuming that there is no albumin here in the Bowman capsule. Okay. Now the filtration pressure. The filtration pressure, net filtration pressure, can be calculated by the forces promoting the filtration minus forces which are opposing the filtration. So what are the forces which are helping? PGC plus pi BC minus the forces which are opposing the filtration, which is the PBC plus pi GC. Now we can put the values and then we can calculate the force. So net filtration force equal to 42 plus 0 minus 16 plus 12 equals to, this is 42 minus 28 equal to 14. So answer is C, which is the 14. Now the next question. The answer of this question is C, which is both growth hormone and the prolactin. Here, if you see, now we will discuss the question in detail, that from the hypothalamus for growth hormone, one is stimulating, another hormone is inhibiting the growth hormone secretion. The growth hormone releasing hormone secreted from the hypothalamus, and it activates the growth hormone secretion from the pituitary. This is secreted from the pituitary. And the somatostatin, also known as growth hormone inhibiting hormone, is inhibiting the growth hormone. For prolactin, there is only the inhibitory control from the hypothalamus, which is by the dopamine. So dopamine secreted from the hypothalamus, and it is causing the inhibition of prolactin. So here the question was about the inhibitory control from the hypothalamus. So the answer will be both growth hormone as well as the prolactin. But if question asks about the which are under the only under the inhibitory control of hypothalamus, then answer will be prolactin. Fine. The next question. The question number 3. The answer is A, leptin. Okay. Here We'll discuss the question in the detail. The growth hormone, the gonadotropin releasing hormone, insulin, growth hormone and leptin. Actually the growth hormone and the gonadotropin, they have the direct role in the puberty. The leptin has a permissive role in the puberty. It causes the helpful in the puberty by increasing the pulsatile secretion or pulsatile release of gonadotropin releasing hormone. So it causes a permissive action, it increases the pulsatile secretion of gonadotropin releasing hormone and helps in the puberty. Now let's discuss little bit more about the leptin. The leptin is the satiety producing hormone. It is secreted from the fat cells. Okay, and what happened, actually it is seen that it is not a etiological factor for the puberty, but it is a permissive factor for the puberty. And it is seen then the females which is doing the strenuous exercise, like sterner athlete ladies and the ladies with the anorexia nervosa, they have the delayed puberty. And it is found that they have low level of leptin also. So it means leptin is associated with the puberty. In such type of females, we can give the treatment by the recombinant derived human leptin, and it is seen that they will start the puberty. So puberty start in these ladies. Now the next question. Answer is A, which is CFU, colony forming unit. During the differentiation, the initial cell, which is day 3 cell, that is the day 3 cell, that is the BFU, which is burst forming unit, erythroid series. After that, on the day 7 cell, you see there are colony forming unit of erythroid. These cells are small, the BFUE cells, and the CFUE cells are the larger cell, and they are the cells just before the formation of the hemoglobin. After that, there are immature erythroblast and then the mature erythroblast. You see, the erythropoietin mainly work on these. Erythropoietin is the hormone which is secreted by the kidney, and it acts on the colony forming unit erythroid series, and it helps in stimulation and proliferation of these cells for the production of more number of RBC under the hypoxic condition. Although the BFUE also is stimulated by the erythropoietin, but there are another factor also by which the BFUE cells also responds. One is erythropoietin, another is stem cell factor, another is insulin-like growth factor 1, interleukin 3 and interleukin 6 and the glucocorticoids. So although the BFUE also is stimulated by the erythropoietin, but it is stimulated by the other growth factors also, but the colony forming is stimulating is only affected by the erythropoietin, and the maximum effect of the erythropoietin is on CFUE. Now question number 5. The answer of this question is B, which is the S3. Let's discuss the question in detail. The question is about the heart sound. So you see that in the pregnancy, the S3 can be a normal heart sound in case of pregnancy. Let's discuss. The first heart sound is by the closure of, suppose this is the heart. These are the chambers, mitral and tricuspid valve here, AV valve, atrioventricular valve. So the first sound is occurring by the closure of atrioventricular valve, especially the mitral valve. And it occurs at the beginning of systole, because when the ventricles are starting in the systole, then there is a back pressure and these valves are closed. So it is the beginning of ventricular systole. This sound is the prolonged sound, but it is a low pitch sound, which is having frequency 24 to 45 Hz. The second heart sound here, this is the aorta, this is the pulmonary aorta, and this is the systemic aorta. Here these are the semilunar valves, here and here. So the second heart sound is by the closure of semilunar valve. At the end of ventricular systole, when there is a back pressure from here and here, these valves are closed to prevent the backflow. This is the shorter sound, but the high pitch sound having 50 Hz frequency. About S3 and S4, they are not usually heard by the stethoscope, but they are heard by the phonocardiogram. Third heart sound is a soft sound, low pitch sound due to vibration in the ventricles, due to the rapid filling phase of the ventricle. It occurs in the early diastole. Actually, it is an early diastolic sound when there is the, if you see, this is due to the rapid filling phase of the ventricles. But it is normal in case of children, in young adult, and in the pregnancy, and this was our question. But it is abnormal when it is found in the elderly, like in case of heart failure. This can be heard without this phonocardiogram, and this is the abnormal sound. Now the fourth heart sound, this is in the late rapid filling phase or atrial systole, and it also due to the vibrations of ventricle, due to the inrush of the blood in the ventricle. This is very weak sound, and it can occur in case of when there is a atrial pressure is very high, or the ventricular hypertrophy is there. Here it is hypertrophy, then this can be the type of sound that or the atrial pressure is high, then it can be the sound it can be here. One more point to discuss, because in the option there was the splitting of the S2. The splitting of S2 is the normal physiological finding, where the aortic valve closure comes earlier as compared to pulmonary during the inspiration. But fixed splitting, it's a fixed splitting of the heart of the S2 sound is occurring when there is no difference between inspiration and expiration. This is splitting found both during inspiration as well as in the expiration, and this occur in case of the AST, atrial septal defect. So it is a finding in AST. And the pericardial knock. Pericardial knock is the early diastolic sound. It is actually a variant of the third earth sound, but it occurs little early. And it is because of the rapid ventricular filling abruptly halted by the restrictive pericardium. If their pericardium is restrictive, then this can be heard. And so this is a feature of constrictive pericarditis. Answer of our question is the S3 may be normal in the late pregnancy. Now let's discuss the question number 6. The answer of this question is C, which is the fibronectin, or if the option was, if the second option might be the collagen, might be the right answer, but the better answer is the fibronectin. If you see this feature, that this is the in the extracellular matrix fibronectin, and which is attached with the collagen. Here this is the integrin dimer, this is the integrin, and it attaches with the actin. So the answer is C. Let's discuss in detail. Little bit about the integrin. The integrin is actually a protein which connects cell cytoskeleton with the extracellular matrix. So it connects the cell cytoskeleton to the extracellular matrix. Okay, it binds mechanically, also it binds the cell cytoskeleton to the extracellular matrix. It also activates the signal of the signal transduction pathway when the ligand is bind on the extracellular cellularly. It works with the other receptors like cadherin, like CAM, cell adhesion molecules and selectins, and have an important role in cell to cell and cell to extracellular matrix adhesion and interactions. So in the options whatever are the given, they all can be the ligand for the integrin, but only the fibronectin binds the actin. The fibronectin binds the actin through this integrin. What about laminin? Laminin was also an option, so you should know a little important things about the laminin also. Laminin is a protein of extracellular matrix. It is also associated with type 4 collagen via fibronectin. That's why this was given also in the option to confuse you. It connects via the fibronectin, via the anactin, and also can through the persilin. Okay, this is the important component of the basal lamina also. And the laminin has a very important role in the muscular dystrophy, as well as nephrotic syndrome. Okay. Now the another option was the vitronectin. This is also the protein of extracellular matrix. It is also the protein of extracellular matrix. It is also found in serum as well as in the bone also. And it also binds through the integrin. That's why it was also the option in the question. Which integrin binds to the fibronectin? It is alpha V beta 3. And this is also bind with the plasminogen, activator, inhibitor 1. So the fibronectin has a role in hemostasis. It is having also the role in metastasis of the cancers. Now the next question number 7. The answer of this question is lysosome. Answer is D. Here, if you see, here it is a single nucleus. In the arrow, if you see, the arrow is just around the nucleus. Here, this is the single nucleus of the cardiac muscle cell. There is a single nucleus of the cardiac muscle cell in the center. And if you see, this is the area just showing the just nearby of the nucleus. The myofibrils passes around the nucleus and they make the area which is known as perinuclear region. That is a biconical type of area, and this is known as perinuclear region. Most of the organelles are condensed in they become concentrated, the organelles become concentrated in perinuclear region. Cardiac muscle is very active muscle, mitochondria is there, Golgi apparatus are there, the glycogen molecules are there, the lipofuscin granules are there. So these all are present in perinuclear area. Around that perinuclear area, there is another space that is known as perinuclear cloud, and in which the lysosomes are present. But the lysosomes are present, but they are very less in number. They are not absent, they are present, but very less in number. So the answer of this question is lysosome, because they are not present in the perinuclear region. Now question number 8. The answer of this question is D, which is the intensity of the stimulus. Okay. Let's discuss the question in detail. What is Weber-Fechner law? Weber-Fechner law says that magnitude of sensation felt is proportional to the log of the intensity of the stimulus, which was our answer, intensity of the stimulus. Actually, it says, just for example, that if your friend say give you a book to hold, the book number 1, and if he add another book to you, and if he asks that, are you feeling the difference in the weight? Then you will be very easily appreciate this difference in the weight, that you can say it as it is almost the double of the sensation I am able to felt. But if your friend keeps just suppose you have previously the 8 number of books, just you have in your hands the number of books 7, and your friend give you, and just you close your eye and he says that you keep another book, and are you able to differentiate? You are not able to differentiate the difference in the weight, or you will be able to differentiate very less difference in the weight. Just see the graph. Here on the x-axis it is a stimulus intensity, on the y-axis the sensation unit. sensation is there, sensation felt. If you see here that the same sensation felt initially will need only the little difference in the stimulus. But later on, if you see that same difference, production of the same difference in the sensation felt will need a very larger difference in the stimulus intensity. So you understand, and this is because of this law. This is the Weber-Fechner gave a law that it is proportional to the log of the intensity of the stimulus. You should know about the power law also, because it is now appear that the power function will give more accurate describe this relationship, which is R equal to K S ki power A. This is R is the sensation felt, S is the intensity of the stimulus, and A and K are the constant, and they are different, but they are constant for any specific modality. This law is for all many type of sensation like the vision, the hearing, the touch. It is applicable for all these. Now the question number 9. Here the answer is C, which is increase precisiveness of the movement. Let's discuss the question in detail. That in the homunculus, if you see, this is the homunculus, is the cortical area of representation of the different body organ. It is upside down. The foot area is on the medial side and on the top. The middle area is by the neck and trunk, then the fingers, then the lip, face area. This is upside down presentation. And if you see here, the area of the finger and the area of the face and lip is very larger as compared to the trunk area. So it means this homunculus, this sensory representation in the cerebral cortex is depending on the use of the part. More is the use of part, more is the area, or you can say the not the use, it is, you can say that is skilled movement. If the movements are more skilled, more fine, more precise, then the area of that organ is larger. For the crude movement, this is the lesser. So if you see the fingers, they have more skilled movement, lips have the more skilled movement, so they have larger area. So answer is C, is the increased precisiveness of the movements. Now this question, question number 10. If you see, the answer of this question is A, the diameter of the vessel. Let's discuss the question in detail. For the organ, any organ blood supply, the diameter of the vessel is very important to control its blood flow according to its metabolic requirement. So an organ can change according to its requirement. That is known as autoregulation of the organ. And also, if you see the Poiseuille-Hagen formula, Poiseuille-Hagen formula says that the blood flow is equals to the pressure difference through the vessels divided by the R. R is the resistance. This resistance is equals to the resistance is equal to 8 eta L upon pi R ki power 4, where R is the radius of the vessel. Here the eta is the viscosity and L is the length of the tube. If you see, because it is depending on the R ki power 4, so you can say a very less change in the radius can make a very high change in the resistance, and it can highly change in the blood flow. So this is the answer is the diameter. Now question number 11. The answer is inferior olivary nucleus. See, this is the Purkinje cell of the cerebellum. Let's discuss the question in detail. This is the cerebellum, Purkinje cell. Here there are two main inputs. One is climbing fiber, another is the mossy fiber. If you see, the climbing fibers is coming from the single source which is known as inferior olivary nucleus. While this is coming and this is directly project on the dendrites of the Purkinje cell, it entwines like a climbing tree here, like a climbing tree, and that's why they are known as climbing fibers. See, this climbing fibers, it is giving the excitatory input to the single Purkinje cell, so it is the stronger input. The mossy fibers, they are coming from to the inferior olivary nucleus, thus they are taking the proprioceptive inputs from all over the body. From all over the body, the proprioceptive inputs goes to the inferior olivary nucleus, and then this is going to the Purkinje cell and directly stimulated. Another is mossy fibers. They gives the sensation, they take the proprioceptive inputs from all over the body also, plus from the cerebral cortex via the pontine nuclei. And if you see the mossy fibers, it goes not going directly to the Purkinje cell, it is giving supply to the granule cell. But both are excitatory, the climbing fibers as well as the mossy fibers. If you see, the granule cell is divided into the parallel fibers, and these parallel fibers, they give the excitatory input to many Purkinje cells. So it is comparatively weaker as compared to the climbing fibers. If you see these parallel fibers, they give the excitatory inputs to the another cells like basket cells, stellate cells also, and they give the inhibitory input to the Purkinje cell, and this is known as feed forward inhibition. Okay, so our answer is the inferior olivary nucleus. Now question number 12. The answer of this question is estrogen. Let's discuss the question in detail. If you see, this is the phases of the menstrual cycle. We divide into, this is the 14th day, which is the mid-cycle peak of LH surge, and it is the ovulation. Here, because mainly the follicles are growing, this is known as follicular phase. And after the ovulation, there is a corpus luteum production. So mainly this phase is known as luteal phase. If you see the different hormones in the different phases of the cycle, you see here the pink one, this is the LH. Initially, see this LH is little bit, you can say very less increase, or it is just a straight line, and just before the ovulation there is a LH surge. If you see the FSH is initially little increases and then it starts decreasing. Again it is increase just at the time of ovulation, just before the ovulation, corresponding with the LH surge. So this occurs because initially the estrogen at low level gives the negative feedback inhibition to the GnRH, but when it is increases up to a level, it gives a positive feedback to the GnRH. This is changed near the time of ovulation, and then there is a LH surge and FSH increase also. You see about these, if you see about the estrogen level is continuously increasing in the follicular phase, and it is also maintained up to a measurable level just in the luteal phase also. Progesterone was low initially and it starts increasing, and it is a very high level to maintain the pregnancy in the luteal phase. So if you compare, although the FSH is little high in the initial phase, but it reduces again, but the estrogen is the hormone which is the continuously increasing and continuously find in higher concentration in the pre-ovulatory phase or the follicular phase. So the answer is estrogen. Now the next question, question number 13. Here they are asking about which marked area is involved in relieving the pain in the response to massage. You see here the area A is corresponding the area of substantia gelatinosa. Substantia gelatinosa is found in the dorsal column. This is the subcell which is responsible for the gate control theory of the pain. Answer of this question is the A. See, let's discuss the question in detail, that substantia nigra in the dorsal column, how it is responsible for the gate control theory of the pain, or to, you can say, the affect the magnitude of the pain. We have seen in the normal day-to-day life, if there is a massage on the pain area, it's like mother just give a massage to the baby at the area of the pain is relieved. What is the region? There are two types of fibers. One is A beta fibers, which are the large diameter fiber. They are the fiber for touch. The small fibers are A delta or C fibers. They are for the pain. Okay. Here in the dorsal column, there are the G cells, or you can say SG cells, substantia gelatinosa. We can denote the both substantia SG cells or G cells. They are the cells which is affecting the T cells. T cells is the transmission cell in the dorsal column, which affects this T cell is the final cell which activates the pain pathway, or which is activating the lateral spinothalamic tract. So if you see the A beta fibers, they are also activating the T cells. The A delta fiber and C fibers, they are also activating the T cells. But the A beta fiber activate the SG cells, and A delta fibers and C fibers, they are inhibiting the SG cells. And this SG cells, that finally they inhibit both the afferents coming from the large diameter fiber A beta, as well as the afferent coming from the A delta fibers or the pain fibers. And this is the modulating cell. The substantia gelatinosa is very important for this modulation of the pain. You see here, if there is a stimulation of T cell via the large fibers, suppose this is the stimulation via the large fiber, that is rapidly cut. How it cuts? By the negative feedback via the substantia gelatinosa. Suppose this is activating this cell, this is activating the SG cells also. This SG cell activation, that inhibits the afferent from the large fibers. So finally the T cells activation is lesser, or you can say it is inhibited, so pain is reduced or it is inhibited. But when there is a stimulation of T cell by the A delta fiber or C fiber, they stimulate the T cell, and this activation increases by the positive feedback through this substantia gelatinosa. How? When it is activating the T cell, it inhibiting the substantia gelatinosa cell, and because this is inhibited, so afferent stimulation from the A delta fiber is less inhibited, you can say. So finally the activation is more. So it is more activation of the T cells, and that is a pain is sensed by the lateral spinothalamic tract. Now the last question of physiology, question number 14. Here it is given the A curve, B curve and C curve. They are asking about what is the A curve signifies. So answer is it signifies the emphysema. Answer of this question is B, emphysema. Let's discuss the question in detail, that it is the compliance diagram. What is compliance? Compliance denotes the stretchability of lung and chest wall. It is the measure of stretchability. And here if you see on the x-axis, it is the transpulmonary pressure, and how much is the change in the lung volume in per unit change of the transpulmonary pressure denotes the compliance. If you see that this is a delta V upon delta P, or the slope of this graph denotes the compliance of the lung. Change in the volume of the lung per unit change in the transpulmonary pressure. The normal value is 0.2 liter per centimeter of water. If you see, this is the normal diagram, and it is shifted up and left. It is shifted up and left. Here it means the compliance is increased, and increased compliance occur in case of emphysema, because it is easy to stretch the emphysematous lung with the less change in the pressure. If you see, the curve shift down and towards the right, in case of when there is a compliance is reduced, and this occur in case of pulmonary congestion and in case of pulmonary fibrosis. Okay, the pulmonary fibrosis is the condition where there is a scarring and the stiffening of the lung, and it is very difficult to stretch the congested lung or the fibrosed lung. Now, thank you.